Good evening, everyone, and welcome to the December 7th Revere Board of Health meeting. Let's all rise to salute the flag. Take it away, Mike. To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Right. Thank you. Present today at today's meeting is obviously myself, Chairperson of the Board of Health, Dr. Natalie Kong. We also have Dr. Craig Costanzo, Board Member, as well as Nezo Luaudi, Board Member. Also present are municipal staff, Michael Wells, Director of Inspectional Services, Lauren Buck, Director of Public Health, and Paula Sepulveda, our Administrative Assistant. The agenda tonight will be as follows. We'll first review and approve meeting minutes from our October meeting. I'll also introduce briefly Dr. Drew Bunker, who's in the audience with us. He will be the new chairperson of the Board of Health, and will start leading these meetings in the new year, January 2022. Lauren Buck will give us our monthly public health communicable disease report. We will finalize and sign the regulations for the keeping of bees in the city. And the last agenda item is to review the urban farming ordinance in relation to the keeping of chickens. So we'll start with the meeting minutes from October 5th. Board members have them in front of us in our folders, and we've reviewed them, and I think we're all going to accept them. Is that okay with you, Paula? Okay, great. All right, next agenda item, Dr. Drew Bunker. He's joining us from clinic today. He works at MGH, also a primary care physician in the community at Revere Broadway. He has been appointed and will be the new chairperson for the Board of Health, again, starting in January 2022. So I just want to put that out there. I will be stepping off since I'm also the Chief of Health and Human Service for the city. So welcome aboard, Dr. Bunker, and thank you for joining us this evening. Moving right along, Lauren Buck, do you want to go over the communicable disease reports?
Sure. So the communicable disease report is a combination this month for both November and December, since we didn't meet in November. I won't spend much time on the non-COVID communicable monthly report. Of note, there have been 12 confirmed cases of influenza from the last 2 months. 4 confirmed cases of hepatitis C and 7 probable cases of hepatitis C as well. Other important notes that I wanted to bring to the board's attention are listed in the report below. I won't spend much time on those either, except to the second bullet. According to new report from the CDC, during 2020, more than 22 million infants missed their first dose of the measles vaccine, which is 3 million more than 2019. This marks that largest increase in 2 decades, which obviously is a concern for a potential outbreak of measles. Obviously, I think this is mostly attributed to where we are with the COVID pandemic. And then I also wanted to update you. The CDC recently released updated blood lead reference values from 5 to 3.5 in response to the Lead Exposure Prevention and Advisory Committee recommendation. As we all know, there's no safe level of lead, but this recommendation is meant to help increase the amount of early blood lead testing in primary care settings. And so I just wanted you all to be aware of some reports that came to me from the CDC. And then finally, our COVID numbers. As of December 6, 2021, we had 13,248 confirmed cases of COVID, 166 deceased. Our current 7-day case average is 38.3. Our 14-day positivity rate is 5.0. Just of note, 5.0 positivity rate was the measure we were using last year in terms of putting us as a red city. So we are technically back in the red if we were using that measurement, which the state does not use anymore. Finally, obviously we all know Omicron variant has been, I'm pretty sure it's, how do we all pronounce it? Omicron? Omicron, okay. Has been found in Massachusetts as of 12/4/2021. Just another note, only about 30% of all samples sent to, only 30% of samples taken in Massachusetts are sent to the state lab for variant testing. Our vaccination rates, I just wanted to give you all an update. This is a report from, I think 2 weeks ago, maybe last week. Percent of total population with at least one COVID vaccine is 81%. Percent of total population that is fully vaccinated is 70%. And then the population that we're all focusing on right now is the 5 to 11-year-olds who recently got approval for the Pfizer vaccine. 7% of the population, of our total population in Revere, is of this age group, 5 to 11. 15% have had one dose, 1% are fully vaccinated. Obviously, we expect these numbers to continue to rise with more vaccine clinics, but it's definitely something to keep our eye on in terms of a population to look out for.
Thank you very much. I mean, as Lauren mentioned, only 30%, so like less than a third of this, about a third of the samples that are being taken in Massachusetts are getting sent for testing. So the fact that we have Omicron in Massachusetts is concerning, but just recognize that not even half of the samples are being tested for this variant, so there could be more out there. And it just goes without saying that the best way to protect yourself and your loved ones as we head into the holiday season is to obviously get vaccinated. Everyone is eligible for a booster vaccine. If you've gotten Johnson & Johnson, you are eligible for a booster vaccine of any type, whether it's Johnson & Johnson, Pfizer, or Moderna. You're eligible 2 months later. If you've received Moderna or Johnson & Johnson, you are eligible 6 months later. And mixing and matching is safe, so try to get it wherever you can. Visit revere.org/vaccine. We have a full month of vaccine clinics scheduled throughout the city. We're going to be co-located in a lot of schools this year because, as Lauren mentioned, we are trying to target the 5 to 11-year-old population. But any adult who needs a booster or needs a first series of vaccines is welcome to come. We will not turn anyone away, so just visit that website. All right, and then moving on to the next item, we're going to finalize and sign the regulations for the keeping of the bees. So Lauren, I think you wanted to mention a couple, the changes that were made and a couple other ones that were made, but we may not have talked about in the, was it the September meeting now?
Yeah, thank you, Dr. Kong. So what you all looked at from the September meeting is slightly different than what you'll be voting on tonight, and I'll just highlight the changes for you. In Section 4, Part A, so the sentence reads, all persons keeping bees in Revere shall do so in compliance with all applicable federal, state, and local laws, rules, and regulations, including but not limited to Revere, RRO, Revere Revised Code, Revere something ordinance, Revised Ordinance, Title 17, Section 16.470. That is an updated RRO Title 17, Section 16.470 is updated from the previous regulations that you looked at based on advising from the solicitor about updating all of our ordinances around this issue. And so that's the updated ordinance that reflects the urban farming regulations. We also, in Section 6, Section 7, Section 8, changed all the word from permit to license to make it consistent with the online portal that we use for licensing. So the word permit was replaced with the word license. And finally, this is something that was discussed at last meeting, Section 11, Part D, the last sentence, health risks shall mean the likely possibility of physical injury or harm to one or more persons caused by the keeping of bees. As you all discussed, we took out physical or mental injury to reflect the feedback we got from the expert that was before us. Those are the only changes.
All right, I mean, I'm okay with all those changes. They were pretty minor, so I'm okay to sign this. I don't think we need to put it to a vote. Craig or Neza, do you have any questions about the changes or any concerns? Okay, awesome. So we'll just pass it around.
One thing, I don't think you actually officially voted in September.
I thought we did. Oh, no, we didn't. Oh, okay. Never mind. Okay, well, let's put it to a vote then. Neza and Craig, or let's start with Neza. Neza, do you vote to approve of this beekeeping ordinance?
Yes, I do vote to approve.
Okay. And Craig, what's your vote?
Yes, I approve.
All right, and I'm the same. I also vote to approve of this ordinance as it's currently written. So we'll pass it around for signatures this evening, okay? All right, and then finally, we're going to review the urban farming ordinance in relation to the keeping of chickens. Similar to the bees, the next kind of layer of the urban farming ordinance is to create regulations so that our residents can formally keep chickens on their properties. So we're going to kind of review that. I guess now, Lauren, are you going to take us through that too?
All right, thank you, Dr. Kong. So we are working on regulations for chicken keeping. They will be similar to the regulations that you all looked at for beekeeping. I just wanted to make you, to get you aware and familiar with the language around the current ordinance as written. And so I will read it to you and then talk to you a little bit about where we are in the process and some other things we've been discussing. So the current ordinance, section 3, reads number 10, hens shall be subject to the following rules. Hens may be kept on residential property only. Ownership, care, and control of the hens shall be the responsibility of a resident of the dwelling on the lot. A maximum of 6 hens may be kept on a lot, although health regulations may further limit the number and/or manner of keeping of hens on lots. No roosters may be kept on lots in Revere. Hen houses are subject to accessory structure setback and dimensional controls of this title. And finally, hens and hen houses are not permitted in front yards or in side yards that abut streets. So those are the kind of, the framework that we're using to write the regulations, very similar to the framework that we use to write the regulations for beekeeping. We have talked to a backyard chicken keeping expert about some extra things we need to include in our regulations, mainly around 3 big things that you worry about with hens: pest control, smell, and noise. And so we will be incorporating a lot of her recommendations to try to mitigate those 3 concerns that one would have in terms of keeping chickens or neighbors who potentially see chickens being kept in other yards. And so we will take all of her recommendations for those 3 big complaints and include them in the regulations that will hopefully be before you in the next Board of Health meeting.
So we're thinking like January, or the first Tuesday in January, okay. Also, I think it deserves to be said, when we discussed this at one of the council meetings, one of the council members asked if this applies to roosters, and I just want to clarify, it does not. We will not be allowing the keeping of roosters, because that is obviously going to be a huge noise complaint, so anyone who's watching, I just want to, alleviate any fears. It's not going to be roosters, it's only hens, so not the noisy kind. Nazar or Craig, do you have any questions about that, or any follow-up questions about that?
No, I'm good.
I believe that's it for the agenda items. So it's been a pretty busy few months before the election. So I think I think we're good to end early. We're pretty efficient, I guess, today. Motion to, is that what I say, Mike? Motion to adjourn the meeting? Yeah, we're good? Okay.